Huh? Ooh, manners respect. Manners respect. Welcome to another educational class. Or can reason, listen, understand. But me tell you, say, me love this. I'm loving this because me I get there's so much information coming forward, right? Um, so much in people to highlight, so much situation to look into. It's amazing, people. I'm telling you, say it's amazing. It's amazing. It's amazing. Because there's so much things happening, right? There's so much detailed stuff happening in in life, right? That really matters. But me say them things that those things are not being highlighted. Those things are not being looked at. Because it's like so we're busy. I do so much other stuff and not really matter. So when we look on certain things happening and listen to certain people talk, I'm getting to understand certain things. It's not everybody who care about the growth, the unity, the love. Remember, I say all hate, greed, envy, all of them things they're selling up. All of those things, um, people love them things there. People love war, them love. There's always gonna be profit when it comes to chaos. That's why this, I say from a born, I never see total peace in the world. Never. I never see the whole world collectively say, for this month, let's put all our differences aside and just deal with paperwork. See if we can solve our issues on paper. Because nothing's happen on paper, you know. There's so much activity on paper. But definitely have to do a life. Me never think so them are alive. These are just um educational form. I guess I could do it in a pod podcast way because it's not like when I do my live with the on camera. All I'm doing is just putting the information out there, right? So it doesn't matter as long as what I'm doing is consistent and in the right direction. People tell say all of the ladies them that I've been highlighting are so amazing. The people them were the people them were I look upon it and say, oh, this is just about the past. This is just about the past. And may I find people present. May I find me not run from the past. You know, I'm gonna be highlighting some people who pass off and stuff like that. But me just erase out of them thoughts. Say everything is just a past. Just that collective right there. You know, so make we get more interested in what the past, present, and future is. Right? So I say them the ladies them what me highlight so far, man. Um Queen Afuya, Dr. Imani Tafari Ama, um these are recent ones that we highlight, right? And it's supposed to be a man and a woman highlight. But I tell you say the woman them is so interesting, have so much to say, so much passion. Um Shazad Ali. She are one of them strong. We did Angela Stanton King. All of these women, like I said, them just have the spirit, the energy, the representation of ladies, female, woman power, heroes. Them represent all of them things there that needs to be highlighted. And since them are forward to me, and me just highlight them glory and them greatness, right? I have no problem, man. And we need to bring up back. You know what? I'm gonna try create a shop. Maybe I'll start that as a project to create a shop where I can sell my thoughts on T-shirt, because that was my main idea. But you see, the people that were supposed to be around my website, right? I'm telling you the issue I have with them people that fit all long and forevermore, right? So, and I like said, I gave up on that idea. Put my thoughts on T-shirt, because Be Unlimited, I have lots and lots of prints for Be Unlimited, and them did up on my website already um until them people have issues, and feel them issues become serious issues. Now I don't have a website with my T-shirt them myself. Very disappointed in that, people. That much I show you, when you try and I try and I try, you just have to keep on pushing, right? You have a message conversation I have with the brother where did I work on the website. Talk about that already. But again, people, there's so much things where I want to put in play, but it's not easy. So today, people, all of the ladies that I'm gonna pick again, it's some of them my research, some of them I have some information or no information, and them is me listening to them for the very first time, and then we can do a part two to them, part three, part four, because that's how I'm gonna create the series and everything, right? So again, I tell you, so most of the things, most of these interviews is on I Never Knew platform. So I'm gonna give shout out to the platform them when me find the people them interesting for listen, reason with, because I am reasoning with them too, even though they're not answer back, right? So I I I give a shout out. I mean, email them yesterday, but no reply. Tell us everything when me other people or more and create my thing is with positive strength and unity. And again, it's not gonna be everybody's gonna be all on the one page, because a man I gonna say, oh, you do enough woman if you do someone. If that's the case, people always gonna have problems with themselves, first of all. Yes, I'm still here, people. I just want queue up the thing and set up the thing and make we run the thing, right? People outside, it feel a little bit much better now. It feel much better than it did feel before, because before it did brutal. So still, no city people now clean the sidewalk. A good thing them kind of melt off, melt off. I'm gonna tell you them serious Canadian series them I go do. and the Canadian government and all of them things there. People, we have lots of information, lots of good content to create about interesting topic, people, ideas and all. So if anybody want always like link me on Instagram, I will put up my information them eventually. So you can link me on Instagram, and if you don't want to be guest on the show and stuff like that, I don't have a problem with that. I say it's not supposed to be me by myself talking to AI and my 10, 20 people them. It's supposed to be me, AI, and 20 people interacting. Right? As we proceed. It's what you need.
The first question I want to have is something that people speak.
Okay. All right. Connected.
54321, Dr. Sean Ross. Welcome. I Never Knew TV. Thankful to have you here.
Okay, so
the first question I want to have is something that people speak about a lot, but it's like barbershop armchair breakdowns. And I want to hear from the doctor what you have to say, right? It's a broad question, so work with it. How does racism impact a person's health?
Racism impacts a person's health in multiple ways. I think it's a great question because we often have people ask this question saying that medicine is really an objective occupation, right? You look at a certain list of diagnostics and you tell a person based on that diagnostic what their diagnosis should be, what their condition is, etc. The challenge is that when a person is looking at that objective data and they have some biases, unconscious bias or not, that is where racism could play a part in someone's healthcare. That's one way. The second way is things that are embedded, medical racism, that are embedded in medicine that people just don't even know exist, like race-based clinical decision tools like the EGFR, the PFTs, where you have a coefficient that's assigned to people who are minorities, and that decreases the likelihood that they receive a higher level of care. Something that it is embedded, and a conscious clinician wouldn't even recognize that racism is playing a part in how they're caring for their patients. So racism can show up in multiple ways, and it's just really, really important that any clinician, nurse practitioner, PA, physician, are aware of their own biases and also are aware of the tools that they're using to care for their patient, whether it's a diagnostic tool, whatever it is, that they are aware and they're checking it at the door as they're caring for their members.
I'm glad that you brought that up, because what I noticed, I saw this in education. People have this idea that whatever the culture is in society is going to be different from what it is in a corporate or private institution. And I think that's the idea. People fail to realize that the same ideas you have about others in your regular life, you gotta have them in your professional life.
We're humans.
Yep. Also, too, can you touch on stress? They speak a lot of. I hear people talk about how racism impacts people, Black people, on just a stressful level and a burden in their daily life.
I think people don't recognize how impactful racism is to any human being, right? The person that the negative effects of, the person who's on the receiving end of racism. I don't think people realize that not just you and I, right? Because we identify as Black people, But even for our parents, our grandparents, for them and them experiencing racism, it starts to change your DNA. Like people don't understand, like allostatic load literally will change your genes. And so when we say that the impacts of racism are generational, it's not just from a mental perspective, a psychological perspective. It is also from a biological perspective. That racism changes their genetic makeup. And then we question why we see chronic disease in Black people at a higher rate of Black people. That's because the social determinant of racism has impacted them to a certain degree that changed their genetic makeup from 4 generations ago, 5 generations ago. And the people that we see today who are on the earth with us today are realizing that from whatever medical condition that they have.
I guess I have a history of stress in the family, like how you process stuff. Mm-hmm. Would that be like, I guess that would be inherited, right? Like how you process stuff. I had to relearn how to like process stress.
We are products of our environment, first and foremost. And so how you learned to process stress from your mom, from your dad, from your grandmother, from your brother, from your older brother, older sister, or even younger siblings will impact how you then learn, right? Again, products of our environment. Unlearning is a lot harder than learning.
People, okay, that's so true. That is so true. I'm telling you, say, it is every time I say, my fifth say manners, respect. Me always I try put the hand in between it. I'm telling you, say, from the beginning of the year that I one of the things I gonna try to just take out one word, out of the sentence. But we are saying because we are saying it for so long, it's so hard. This one I say bad habit. It's hard. It's hard. It's like a decision you have to make to say, okay, fine. Let me slowly stop. It's an awareness as we proceed.
Learning is a lot harder than learning. And so when you recognize that there is a need to change the way that you are processing stress, which is vital for good health, when you recognize that, it's really recentering around allowing, you can't necessarily prevent stressors from happening, but when you recognize that they are there, is what do? Do you in a healthy way separate and process? Do you go for a run, take a bike ride, read a book? However it is that you're learning good habits versus the unhealthy habits that exist, particularly among Black people. And I don't say African Americans, because African Americans leaves out people who are immigrants to this country who have lived here for a long time. So however you choose to relearn how to deal with stress, the key is that you are not absorbing it, keeping it in, staying quiet, and allowing it to silently kill you.
I heard you once say, and I'm quoting you, in our culture, mental illness is often dismissed as weakness or self-indulgence, right? How has this cultural view of mental health contributed to the large amount of unacknowledged and untreated mental health issues people in our communities are struggling with?
I would say vastly. It's contributed vastly. If you don't feel comfortable sharing that you are having intrusive thoughts, if you don't feel comfortable sharing that you are sad or depressed or have anxiety, that perpetuates. And it shows up in multiple ways. It shows up in, getting sick all the time, being ill. It shows up in not being able to keep a job for a long time. It shows up in just lashing out, and then people start putting labels on you, when really at the root of it is that you're dealing with something internally and you need help to manage it. Unfortunately, in the Black community and in other minority communities, it is considered taboo because you are looked at as a weak vessel. I think the more people feel comfortable about talking about their mental health challenges, the more commonplace it will be. I will say I am first generation Nigerian American, right?
What?
And my youngest sister now talks about therapy, something that I tried to do. There's 10 years between us previously, but they didn't get it. But over time, as I talked about it, my other sisters talked about it. Now to the youngest, they're like, "Oh, you're going to therapy today? Okay, have a good session." And so it is really incumbent upon us who are enlightened, if you will, to continue to talk about it, continue to have those conversations and understand.
Okay, fine. So I'm not gonna need money for that therapy too. Look, if everybody have mental issue, my mental issue is deep. Me need therapy to help me out. I think if me probably sell more sauces, my mental issue would probably kind of solve itself. Cause tell us, I would love to be more successful, and that's one of my biggest mental issue. How comes me not rich yet? How comes me not have $1 million yet? Well, not in a sense, I'll do anything for it, but I want to do it my way. So is that a mental issue? Mm, yeah, so maybe we need, we need money for therapy too.
About it, continue to have those conversations and understand that we're human. We are not meant to be invincible. Life is stressful. I don't care how much money you have, what you have surrounded yourself with that may be better than someone else. Life is stressful, inherently stressful, and we have to do what we can do to manage it and go through life living well. I think we have to live well.
We had a conversation with the rapper Styles P. He was talking about his journey in therapy,
Yeah.
right? And we were saying, as a man, it's like the most vulnerable thing you could do, really opening up
Yep.
to that level.
Yeah.
And it's kind of scary to hear yourself say certain things. And if you have a good therapist, hear what they have to say
Yeah.
about that vibe, you know?
Yeah. Styles P from the Locks, right? So his
Okay, and the Locks is a rap group. When we got music, we probably are gonna do them, cause them I think them is a good artist. I like them music.
me and other people's journey, right? Because I think people talk about mental health and they forget that there are many contributing factors to a person's mental health. Where you grew up, who your family is, what your job is, so many contributing factors. And as long as you are aware of that and talk about it, it could be at the barbershop. That's therapy, right? Just talk. I think it's important.
I'm glad you said that, man, because when people do talk about therapy, it has to be like even a therapist. I'm blessed. I have my wife. I have some solid brothers that I can actually talk to.
Yeah.
You know, not necessarily get a response, but just to verbally
Mhm.
say certain things. I know most people don't have that, but like, truth be told, you can't have that therapy session informal therapy session.
I think that's the key word, informal, because my therapy colleagues, psychotherapists, psychiatrists, psychologists, they are trained in this discipline, and they know, of course, better sort of than the lay person. But I think the key is that would you?
Okay, and again, I tell you, say, if you go to all of them people, all of those psych people, it costs money, right? But I'm telling you, say, if the community was a better place, right? If the preacher, right, was going through the neighborhood and talk to the couples, them, right? If you have community center, those are the things that would ease the pressure of the stress that we have when we don't have community, we don't have good family members where support in that sense of positive sense then, right? Your job, your co-workers, all of these things are people who are around you all the time. Now, I'm not saying if you got work, I tell the people there's a problem, but I'm just saying, right? But when it comes down to everything is based on money, there is no community. And when people look upon you and look upon you according to money, monetary wise, right? Them don't have no time for listen to what bother you mentally. That's why I say mentally, we all have issues, right? And we all deal with it in different ways. As we proceed, people.
But I think the key is though, is that talking is healing. And if you're talking to the right people, people who are going to help you restructure your thoughts in a positive way, restructure your
That's that
thoughts
part,
in a way that is
restructuring your
helping.
thoughts,
Yeah,
changing your perspective on things. They're
absolutely.
giving you, allowing you to have a broader perspective on it instead that one.
Exactly.
Right? I agree.
Outlook is important. Very important.
I'm quoting you again,
Okay.
right? I was reading one of your articles. You were saying health is incredibly complex, right? There are
Yep.
multiple factors that contribute to our overall health and well-being. Among these factors are social determinants of health, variables that may create huge differences in experience and exposure of people in different demographics, right?
Mhm.
You mentioned financial situations, social connections, employment opportunities, education, access to healthy food,
Yep.
access to healthcare, experiences of discrimination. The question I have though is like, based on all these things listed, right? What is the reality of a Black person being healthy in this environment?
Yo, by the way, people, this woman is beautiful, right? She has a beautiful smile. Her hair is nice. She's beautiful and she's intelligent too. By the way, she's a doctor.
All these boxes.
That is a great question. And I would say it almost seems daunting and insurmountable when you look at it that way. If you live in certain parts of the city, right, versus if you live in the suburbs, there's a 20-year difference in your life expectancy based on your social drivers, social determinants.
Sorry to cut you. 20-year difference?
20-year difference. So I originally am from Washington, D.C. If I live in the southeast quadrant of Washington, D.C., certain parts like Ward 7 and 8, I am expected to live 20 years less than someone on Capitol Hill, right? It's wild, it's crazy. It's not an easy thing to overcome when you go through that whole list. I think the most impactful social determinant of health is economic status. It is hard for someone to eat well, to have good access to healthcare, to have good access to housing, to have green, around them, parks, whatever, if you don't have the money. If you cannot pay rent, that is, you could pay rent here, say in the Ward 7 and 8 in DC, but you can't pay rent in Capitol Hill. So what it's going to require is policy changes. What it's going to require is systems thinking. And I think when we talk about reducing inequities amongst groups, the challenge that we have right now is that we have people who think that they know how to reduce inequities. They think they know what to do when it comes to health equity, but they have no experience in policy, no experience in healthcare, or they have singular experience and they use that to color all of the interventions. It requires systems thinking. It requires bringing lots of different people, different disciplines to the table, to close those gaps, to help Black people.
And I want to go back to this health thing, right? Because the money, I think, brings time to reflect if you want to. Like,
Sure.
you can overdo it with work, but I noticed that with money, it gives you like time if you want to do it, time to reflect. And that's where the healing really takes place. Like, you need like a lot of quiet time. You need time to think.
Yeah.
And if you're doing the 3-job thing, running up and down, you're just in survival mode. But I see a lot of people doing that have money too. And that's the problem that they run into. Like, you have the money, but you're still in the survival mode,
mentality,
and you're not taking care of yourself.
Yeah, I think it's a mentality. You talk about people who have 3 jobs who are looking to just survive, right? And then they go homes to places where they cannot sleep well because it's constant sirens. They cannot breathe in good air because of they live near a factory, or people who were able to take themselves out of that situation, put themselves in a better, air quotes, situation, and they haven't been able to shake that off. I think being under constant, consistent stress for years goes back to our earlier conversation. You have to unlearn that. That is not something that people can easily, because you are fearful of finding yourself back where you don't ever, you don't want to go back there.
I want to discuss the nursing crisis that's affecting the quality of life and healthcare costs across the country. Why do you believe America has a nursing shortage? How is the shortage impacting healthcare costs and quality of service patients are receiving?
You mean all the colleges that they closed down, and all the students that used to go to school and learn to be nurses and stuff like that, that don't exist anymore? That's probably one of the reasons. Not saying it's all the reasons, but maybe that's one of the reasons. As we proceed, people.
That the nursing crisis is a cyclical thing. You don't have enough professors, right? Because you don't pay them well. Nursing professors, you don't pay them well. And if you don't have enough professors, you cannot accept more students. So you graduate the students that you graduate them, and they go into the field. And, it can be, so by the way, I am a family nurse practitioner. I started out my career as a critical care nurse, worked in the ICU for several years, worked in the cardiothoracic unit for several years, and got my leadership chops, if you will, from working as a hospital administrator. So the nursing crisis is a real thing. The nursing crisis absolutely affects quality and safety. But when you think about it, again, back to that cyclical cycle, you don't have enough nursing professors to teach nursing students. Once you have those nursing students that graduate, they go into the field and they are burnt the hell out because there aren't enough nurses there. Then you have multiple people leaving the field. Some will say,
in every industry, pretty much that's what it is. Because I tell you, when I started out in cooking, all the teachers, the top chefs, they work at one place for a long time. They were good chefs. The industry was good, but then them start disrespect these people. Oh, they can get better and this, do that. Oh, you're not the chef. You're just what we say. Stuff like them there. So in every industry, it's the system that drives out the good people, because the good people know what the system is supposed to be like. But when it comes down to this thing called money, 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 as we proceed, people.
Enough nurses there. Then you have multiple people leaving the field. Some will say, is it, well, increase salaries. Salaries is not it, right? Because people, after a while, if you're a nurse, you love your job. You do the job. You want to be paid well. You want to be paid as acknowledgement of what you're doing. But I think the biggest reason why there's a nursing shortage is because nurses are counted as an expense in a hospital setting rather than a value add. And so physicians in the hospitals have RVUs. They're counted, they are budgeted in a way that accounts for their value. We as nurses are only accounted for as an expense. And so the first thing everyone does is when you see that you're about to go over budget or you aren't going to hit that 3% margin, you cut the nurses.
Sounds like teaching it. It's pretty bugged out. It's like the same thing. Please explain how the shortage is impacting the quality of care people are getting. Because I had a nurse tell me in private that, what she say? I can't use the word that she used because she was cursing, but basically she said, if you don't have to go to the hospital, don't go.
Imagine that, eh? I'm telling you, it's crazy how things slowly is getting worse because it's a deliberate thing to cut the teachers, cut the nurses. You see, the very fact that they look upon nurse as expense. Jesus. The very fact that them count nurses as expenses. So once them start budget go sideways, them start cut the expenses. This is the mentality of some people who say they're human, because that's not a human behavior. I'm gonna tell you, say way back at the same thing them people are do. Their practices is so sideways. As we proceed, people, and I'm gonna tell you, say if them do this to all of them things, and the same thing, look at the pilot them, how much plane a drop. You know, things them probably do the same thing. All of the top pilot them probably cut all the top pilot them, and I keep the rookie them. We don't know, because when them say cut budget. As we proceed,
I think that's a bit harsh.
Yeah.
I would never suggest that someone not go. I would tell them to research where they're going and go to that hospital. But if you need to go to a hospital, go to a hospital. But I would say that it impacts safety because we have professional organizations. Nurses have several different professional societies, professional organizations. I will use A1 as an example, the Association of Women Obstetrics and Neonatal Nursing. And then I can go to ACCN, which is critical care nursing. A1 says if you are a labor and delivery nurse, you are only supposed to have 2 patients.
That's it.
Period. If they are in active labor, you're only supposed to have two patients.
That makes sense.
If you're short of nurses and you have 4 laboring people on the unit and all you have is 1 nurse, maybe a charge nurse and somebody in triage, meaning nurses, it's too much. And so that's how it impacts quality and safety.
All right, I want to discuss how the inclusion of race in numerous clinical decision tools directly and indirectly impacted the primary, secondary, and tertiary prevention of illness among Black people.
Well, that's good.
For example, I'll use breast cancer surveillance. You could correct me, you're the expert. I was reading an article, they were saying Black women are less likely to participate in initial screening, but also less likely to follow up with diagnostic imaging after an abnormal mammogram. Personal experience, right?
Yeah. Primary
care physician, right? There's no follow-up yet. Like, you don't hear anything from anyone. And the weird thing I saw is that, like, I don't want to get into it, but just, I'll talk it off.
So I will say that this is a multi-dimensional challenge, right? Anything in healthcare that needs to be fixed is a multi-dimensional issue. It cannot be fixed by just one thing. Now, when we talk about, primary care, since you mentioned primary care, and I'm a primary care clinician, you have to think about the way that primary care clinicians are paid.
Business setup.
Yeah, it's not set up for success because you have the way that in order to be successful, right, to run a practice, to live a decent life as a primary care physician, you have to see patients every 15 minutes. That's the way organizations, hospital, healthcare systems have set it up. There is not, I'm not, say Busta Rhymes, right, who can say a whole bunch of things in under a minute. And even if I could, my patients wouldn't even be able to understand me. So I have to look at a patient, I'm sitting across from a patient, and I have 15 minutes to talk about your past medical history, what currently is wrong with you, help explain what my diagnosis is, what the medications you might be expecting or you might expect to get from the pharmacy, all of that in 15 minutes.
Wow, that's crazy. I didn't even know them about time. Them have a time limit on seeing patients. I never knew that. That's crazy though. The people them even calculate how long the doctor supposed to see the patients for. That's some crazy stuff, people. That's some crazy stuff.
In 15 minutes. And talk about like, say you're, and then I look at your vital signs and I say,
Everything, people, is done calculated according to profit. It always comes down to that profit. The only thing that matters is profit. As we proceed, people.
in 15 minutes. And talk about like, say you're, and then I look at your vital signs and I say, oh, your blood pressure is high. We need to talk about your blood pressure. I have to fit that in 15 minutes and complete my charting before I go to the next room. And so when you think about it in that situation, primary care, the way that it is currently structured is untenable. That's separate from, say, race-based medicine, where you have cancer as a global discipline. Cancer has not really addressed race, the inappropriate use of race in their clinical decision tools. The likelihood is because race is the greatest sort of, it is connected the most to social determinants of health. And so because they don't have anything else to replace it with, they continue to use race. Well, I will say, one, the Black body is no different from the white body. Two, you accounting for the stress of social determinants, we got to figure out how to do that, because Black women epidemiologically have cancer, breast cancer specifically, less than white women. The challenge is, though, is that because we are using tools that, from an epidemiological standpoint, say that Black women have cancer less than white women, that means when I go to my primary care,
looking for it as much.
They're not looking for it as much. And then when they don't look for it as much, we continue piling on the stress. We can't go to the doctor, and then it gets to a late stage, and then we have worse outcomes. So that's why I say it is a multi-dimensional challenge that needs to be addressed.
I want to jump back to the business model. Right? When did it change to this fifth? Like, you just have to rush. Everyone goes to the doctor has the same complaint, right? But when did the business model change to where a doctor has no time? Because how can you make an accurate analysis of a person?
In 15
you have
minutes.
To do your report. We have to talk to them. We have to recommend like. So what is the origin what is the origin of this business model?
I would say insurance, health insurance. And health insurance is a good thing. This is not a knock against health insurance. I am a former employee, excuse me, of a health plan. The challenge becomes when the hospitals are treating sick patients and the health insurance wants to keep everyone well, if you will. They want to prevent people from going to the hospital, right? And so that is sort of from a hospital perspective. From a primary care perspective, I think as a society, we have idealized specialties more than we have primary care. Primary care is the foundation of health in America. But we see cardiology, all of the specialties that are in an IST, right? Like cardiologists, endocrinologists, like all of those people get paid more because they're specialists. No knock to them being specialists, including my MP and PA colleagues who specialize in certain conditions. But when you prioritize a specialist versus the people, the bedrock of health, particularly in America.
Again, people. It comes down to all you have to be is a specialist. You're gonna make the money. But the basic people them can't get no money. Them just can't get no money because them are not specialists. Wow. Just to see it from a doctor's perspective, right? And that me say, it's affecting, it's not just affecting one area, it's affecting all areas. Wow, people. Educational. 15 minutes on the ask the doctor if you can stay 20 minutes and see what him say. For real. We have to test it out for real. Usually in time I go my doctor, me not take 15 minutes. It's usually 10 minutes or so. Because all you usually see me show me go to him for. Wow, 15 minutes, people. 15 minutes. As we proceed. Wow.
Versus the people, the bedrock of health, particularly in America, that's where you get the problem.
What about citizens, though? What I notice is that there seems to be this, I don't want to say laziness, maybe that's too harsh, but it just seems that I personally don't play a role in my health. Whatever is wrong, just give me some medication and I'm good with that. That seems to be like the culture.
You know why? Part. And this is I tell, like, as I teach students, I teach a health policy class, is that we got to be careful about shifting blame to people.
All right.
Right? So take, for instance, your wife, the primary caregiver of you and your children, right? She has a full-time job and offices, you can't see a doctor Monday through Friday, 9 to 5.
Yeah.
When's she going to go take the children to the doctor?
Right.
When is she going to advise you to go to the doctor because you are her help, right? And helping her care for your children, helping her care for herself, for your extended family. And so it's just the setup in general. Can we get provider offices to have weekend hours or late night?
Yes. That's the next thing I always say too. How comes the doctor just 9 to 5 like everybody else? Well, everybody goes to work and go to work 9 to 5. Them things I'm think about people. How comes them not have later hours? Some dentists do, but doctor a different story. As we proceed, people.
But you have to remember that they're human too.
Facts.
They have families. They need to get back home. So when I say it is a multi-dimensional,
sounds like a screwed up system.
Yeah,
sounds like a screwed up system. So there are many news stories where physicians have been accused of sexually harassing patients, right? Though patients sexually harassing physicians seems to also occur frequently, but does not get the same amount of attention. In your experience, how frequent is patient to physician sexual harassment take place?
I would say that there are reasons why there are sexual harassment laws. There's a reason why they exist. Sexual harassment happens in every discipline. Sexual harassment can happen on an elevator, excuse me, between two completely, two strangers. And so I don't want to make it seem like it only happens in healthcare. It happens everywhere. Now there was an awakening.
It happens everywhere. That's true because there's perverts everywhere. Right? People, why? Them have some people out there we call them man, but them a monster. Right? There's monsters everywhere. And then just pretend to be humans. Everywhere you go, you find monsters. So there's monsters everywhere.
Everywhere. Now there was an awakening about it in 2014, 2015. It was all over the news. But workplace violence is workplace violence, whether it comes in the form of sexual harassment, whether it comes in the form of like, being assault and battery, if you will. Nursing, particularly, or when you see a female, and there's this sort of power dynamic that men men believe that they can take advantage of. That's when you have sexual harassment. I think it's really important for women, all women, to be very comfortable challenging that power dynamic if they are confronted with something that looks like sexual harassment, and being very clear and say, I think you're about to cross a boundary. Please stop. If it's a patient, you'll say, I am going to ask for you to be assigned to someone else because your behavior is inappropriate. And for all people who experience sexual harassment, document the hell out of it.
And there's a part two to the question.
I don't know how a man I go on sexual mess with a woman who have all kind of nigga. One of them nigga have all kind of chemical in it can put you to sleep forever. So them really foolish. We just have to say one joke or anything, and you're gone. And you're gonna mess with the people them.
People who experience sexual harassment, document the hell out of it.
All right. And there's a part two to the question.
Excuse me.
How come it's not getting listen to you now? I could get a deeper understanding of what you're saying. How come there's not a lot of news coverage about
it? Because I think if there was news coverage about it, it would be on the news every day, all day, incessantly. And so it becomes something that the health system, the CEO, the COO, the CNO, so Chief Executive Officer, Chief Operating Officer, Chief Nursing Officer, are very intentional about addressing at their institutions. I think that is the best way to handle it. They are over, like, hospitals are closing left and right, but there's still like 5,000 hospitals. Yeah. And so it's really, really important for the leadership of the hospital to set expectations, to hold people accountable, to prevent it from happening. But it would be like when we see violence on the streets and it's on the news all the time and people just tune it off because it's too much, and then they become desensitized to it. It would be like that.
Sounds like sports culture. Listen to you refer to like what's going on. Yeah. Sounds like sports culture in a sense. How it's like baked into the culture, but no one wants to talk about and accept it.
It's baked into the fabric of society, and not.
There you go. In the very fabric of society. The very fabric of society, them have some sick people out there. And then the sick people them have other people that cover up with them. Because all the time my dad started the series the parents them when know what go on and not say nothing about it or not do nothing about it. The accomplices. Them people are worse. Those people are worse. Because they make them people that do the things they want to get away with it. As we proceed.
Into the culture, but no one wants to talk about and accept it.
It's baked into the fabric of society, and not even just the United States. I'm talking the whole world. It's baked into the fabric of the.
Thank you. The whole world.
Patriarchy, and where men are at the top, women are below, and when men are seen as the stronger vessel, women are seen as the weaker vessel, and humans innately are the desires to dominate. And so it is up to women to stand their ground. Again, this is codified in law. It is illegal, right? So stand their grounds, report, document, and the hope is that people will be held accountable.
You've been doing a lot of work and writing on different topics. So I was reading something you wrote on race-based medicine, right? So,
Yeah.
you wrote in one of your articles, in many ways, race-based medicine has driven or contributed to the unacceptable health inequalities. Please explain for those unaware, what is race-based medicine?
So before I talk about what race-based medicine is, I'll talk about what race essentialism is.
All right.
And what race essentialism means is that there is an inherent difference between the white body, black body, Hispanic body, Asian body, right? Back in the 90s, Bill Clinton held a press conference in the White House that said that on a genetic level, humans are 99.9% the same. So we know that this idea of race essentialism is incorrect, but the challenge is that it's already embedded in medicine. The way that it shows up in medicine is through those clinical decision tools, and which is why it's called medical racism, but it's through those clinical decision tools. And I'll give you an example of one. Everybody goes to their physician or clinician's office, and during their physical, they get their labs drawn. One of the tests on that is a basic panel or comprehensive panel is an EGFR. An EGFR is the estimated glomerular filtration rate. It tells you how well your kidneys are working, right? If it is above 90, you are golden, right? You're great. If it is, like really great, so there's no problems with your kidneys. If you are between 60 and 89, we'll say, yeah, your kidneys are still functioning well, right? But be mindful if you have hypertension, high blood pressure, high cholesterol, which is cholesterolemia. Like if you have those sorts of things, then we say we try to make sure that we can protect your kidneys. Once it gets below 60, I, as a primary care clinician, can no longer manage you. You have to be managed by a nephrologist who is a kidney specialist. The challenge with the EGFR is for decades, I almost want to say 100 years, the researchers back in the 1800s, 1700s, decided that they did one research study and said, because Black people had more creatinine in their blood, that they created this equation that now used on you and I. It was a flawed and inappropriate, it was just a horribly done research study.
Flawed and horribly done. Flawed and horribly done research study. So, how you can spend money on something when not good? Let's listen.
Again, remember, 1990, Bill Clinton Genomic Project said that we're all the same. So you go to your provider tomorrow and get an EGFR. Your EGFR, your number, I'm sorry, I skipped a part that's really important. There is a readout. If you are white, this is your score. If you are Black, this is your score. Okay. So it gives you two different results. One if you're white, one if you're Black. So if you, as a Black man, go to your provider and your provider does this test, this EGFR, your test, if it was read as Black, is 61. If you are white, it would be 59. So if you were white, you would receive a higher level of care. But because you're Black, you're told that your kidneys are functioning normal. That's where the negative impacts of race-based medicine come in. Excuse me, because we were not allowed to receive a higher level of care. And so when you see patients disproportionately Black people who are on dialysis, who need kidney transplants, we say to ourselves, it is because this structural problem with this EGFR test is there that prevented people from getting the care that they needed earlier. And so with the work that I did in Philadelphia with the Regional Coalition to Eliminate Race-Based Medicine, I created that because there were 15 tools that people are using, majority of them every day, that were negatively impacting patients. And so we could talk about health equity later and what that means. But getting rid of that type of structural issue is how we help people, Black people, realize their best health, because there are things that the layperson wouldn't even know was negatively impacting them.
All right, so these ideas we have, it's in the medical theory. It's already there. Like, but then he's talking about I just feel Black people feel more pain, and
so ridiculous.
It seems like that's fueling maybe the medical theory. Please correct me, but also, is that in the psyche of some people when they're treating Black people, even other Black physicians?
That is a great point. So that is the unconscious bias I was talking about, right? Is unconscious bias shows up when it's unconscious, like you don't conscious. I don't believe that there are people out here who says, I want to treat Black people poorly. I cannot believe that there is a clinician out there who really wants to treat Black people poorly. The challenge is that there are these things that exist. Even I, as a clinician, I've been a provider for 20 years. Even I have given the Black result because science said that that's the best way to do it. It wasn't until recently where you start asking yourself, like, how is this? Why is this?
See, once you start ask the question, people, then they're not gonna say, I'm confused. Because she was confused before she started asking the question then. As we proceed, people.
Why is this? If we know that Black people are genetically no different than white people, why are we giving two different results? And I have to give hats off to the medical residents of the 2020, 2021 who started asking these very pointed questions, because I mentioned something from kidneys. It exists in cancer. It exists in pulmonology, which is your lungs. It exists in cardiology, which is your heart. It is pervasive. It exists in how we give medications, how we interpret, like it exists. And so rooting that out is really important. Now, and I mentioned health equity. Anybody who is doing health equity work right now needs to understand that health equity work, CDC says, the CDC definition is everybody has the right to their best health. Well, what does that mean, right? Like people who are working in health equity, what does that mean for you in the space that you're working in? Ultimately, health equity means that you're closing gaps between groups of people. Ultimately, health equity means that one group of people should not die more or faster than another group of people. It is literally morbidity, mortality. How are we going to make sure that we are all on an even playing field, right? And so when people say that they're doing health equity work, I think I always smile because I'm going to ask them how. How are you closing gaps? Don't tell me you're doing health equity because you're giving out only food vouchers, right? Don't tell me, because the moment you stop, that's not infinite. Like that's not going to continue. You cannot. It's too expensive.
I'm glad you're here for this conversation, because earlier on you kept saying how you didn't use that word, but you say it's a complex issue. Right?
It's a complex issue.
And listening to you now about health equity, you can't just focus on the health aspect. You have to focus on the social, economic, and everything else, because environment, as you said, impacts health along with you providing the proper treatment that a person needs. So I'm glad you broke it down so people have a deeper understanding of the complexity of what's taking place.
Yeah, it requires systems thinking. Like, if you are going to do health equity work, you have to be a systems thinker. And you have to also help people understand that health equity work is not a zero-sum game. Just because you help me doesn't mean that somebody else is going to get less. And so being a systems thinker is vital in doing this work.
Why do you do this work? Why don't you just stay in that corner office and just do your thing? Why are you out here ruffling feathers and doing all this other stuff?
That's a good way to put it. I am ruffling feathers. You know why? Because I'm living in my purpose. This is my purpose. My personal ethos is to speak for those who are disadvantaged and to administer justice. That is from Proverbs 31, 8-9. It's adapted from that. I could not do anything else because I wouldn't do it well. This I do well because it's my purpose.
Obviously, you've done a lot throughout your life, right?
Yep.
You've had to have a lot of dedication, a lot of consistency, dealing with the ups and downs. What advice would you give to the sisters who are trying to, achieve goals, not be discouraged, bounce back after being knocked down numerous times? I'm pretty sure you've been knocked down 1,000 times in your life and you continue to get back up. What advice would you give to those sisters?
The way that I hear it the most is imposter syndrome. Being in these corporate spaces, you are the only in the room, whether it's the only Black person, whether it's the only woman. And we always have known that in order for us to even be in that room, we have to be 4 times as better. We have to be better. And so with that knowledge in the back of your mind, knowing that the reason you're in that room is because you're 4 times as better than anybody in that room, then you walk in that room with confidence and you walk in that room with purpose. Now, I will tell you that the machine is mean. That machine is mean. And so having that understanding, it is vital for us, particularly us, to have coaches, to have mentors, people that we can confide in, because I have learned that the way I want to frame something, being a girl from Southeast DC, might not necessarily resonate in that boardroom. And so having people to talk to help me frame concepts, to help me frame conversations, so I don't come off like, who the hell are you talking to? Versus, the comments.
Look, it's funny. We have to find a way how we can talk when we go to court and when we're in the boardroom and in the corporate room and when we're in the hospital and when we're in uptown and when we're into our sophisticated situation. But we don't know if we talk to each other. Imagine that. Imagine we can have actually culture how we speak in every situation other than when we speak to each other. Imagine that. That man said, we don't know how to talk to each other. So maybe we have to create a language. Maybe that's what we're supposed to be doing. And we can do that too. As we proceed, people.
Who are you talking to? Versus, the comment that you made the other day was questionable. And I am seeking to understand why that comment was made about me. And then you sit there. I learned this from a great mentor. You sit there and wait for them to respond. And so it's those types of things
Well, how can we do that? Why can't we have that dialect between dialect that communication between each other? Cause I'm telling you, when she say who you talking to, who you gonna be talking to like that? Anyways, that shouldn't even be a conversation. That shouldn't even be a way. People, welcome to education. Welcome to class. Welcome to understanding. And these are the things I keep on saying. How we talk to each other. We never have anything good to say to each other. It's always disrespectful. It's always in a contemptuous way. It's always in a negative way. It's always, I don't see you. This is how we treat each other, people. But we have to come up with a brand new, different language when we're going certain places. Because when we go to certain places, how we talk to each other is not tolerated. People, think about that, Think about that.
Mentor, you sit there and wait for them to respond. And so it's those types of things that it's vital for women, particularly Black women in corporate America. But that imposter syndrome stuff is dead. We are 4 times as better.
And, how do you keep your mental health intact being in that environment?
That's a good question. I am an avid reader, and
Back to the reading thing again, people. You hear? I'm an avid reader. So once you read, you understand enough. Once you read, you understand. This is what I'm saying many times when I hear people talk. It's, how can these people talk in such a shallow way? Because these people, they don't read. As we proceed, people, come tell us the people them, these are professors, and with the professors, they must say it's way more than, well, it's way better than I'm saying. I don't know if them talk more than me, but it's way better than what I'm saying. But I feel good to listen to these people. I know, say, in some capacity, I have thoughts like these people have. I don't have all their thoughts. As we proceed,
I separate. Phone is turned off. I find a book and I just read. I go somewhere else, like mentally. You know, having a great imagination and you can sort of visualize that book.
See, the same thing we say. Visualize everything is like, yo. It's so clear when the books are so descriptive. You can't just imagine yourself. This one I say, it's true. When you read, it's like you go away. A book take you there. I said we take you there too. I think meditation takes you there. There's many paths to get there. Many people take different route to get to the top. But the calm, that's why I say I want to do some live like 2-3 in the morning. See how things work out. Because again, that's when it's gonna be calm, and then when these people talk with clarity, clearness. It's amazing as we proceed.
Does that, vacations do that, mentors do that, an executive coach, and you need a tribe. Like I said, I've been a nurse practitioner for 20 years. I have a group we call the MP Network. And so anything goes down, that chat is going off, right? Because we're talking to each other and helping each other I don't know if we will ever understand why we're treated this way, but helping us manage it and navigate it.
From what I understand, majority of medical research is based primarily on white male subjects. Why is it still accepted in these modern times?
So I don't think it's accepted anymore. The challenge is getting minorities to agree to be part of research.
Oh, that's a no-go.
There you go. I think it's because we have had such terrible
Tuskegee experiment. We're gonna do a next series on the Tuskegee experiment too, because until I say all of them people will do all of them cruel things, all of them people that get away. All of these people always get away with all of these atrocious crimes, right? But we're gonna go back to the Tuskegee experiment. As we proceed, we're not a reason for trust them, trust me.
Experiences with medicine. When you think of Tuskegee, the syphilis thing, when you think of the fact that what we know about obstetrics and gynecology was literally on the backs of Black women. They were surgeries were performed on them with no anesthesia,
which is crazy.
And so, like when you, I can't even conceptualize that in my mind. Like, so when you say,
for context, real quick, what year was that done with the gynecologist?
I would say the birthplace of that was actually Philadelphia and the 1800s.
That's crazy.
Yeah. And so when you think of that generational trauma, right? Inherently, Black people don't trust research anymore. They barely trust medicine enough to go to the doctor. We are trying to undo that, trying to instill trust. And so when we talk about things like race-based medicine and talk about things like how does stress affect the Black body and how that shows up, we use that now in an effort to encourage Black people to participate in clinical trials, whether it's drug clinical trials or research trials. It's really rebuilding the trust, educating people, helping them understand that their participation is vital in changing the way that Black people are cared for in the future.
Much emphasis is placed on inadequate and culturally insensitive prenatal care Black women receive and its role in high maternal and infant mortality rates. What other factors contribute to the disparate prenatal outcomes experienced by Black women and infants?
You know, unconscious bias is a real thing. And I think that trying to mitigate unconscious bias is really hard. Because things happen and you don't even know that things are being coded in your brain a certain way, right? When we watch the news and all you see is crime and these sort of these disadvantaged neighborhoods, and everyone you see on the screen is Black, right? You immediately socialize that with all Black people. And the moment you see a Black person,
it's true. And trust me, it's psychological for them as much as it is psychological for us. So when them look on your resume and them see all the skills, I go, is he gonna be this or is he gonna be that? Enough situation. And we do it, me tell you say, oh, we treat each other 10 times worse. As we proceed, people.
With all Black people, and the moment you see a Black person, even though they could, I mean, Beyonce had to deal with almost having a negative outcome. Serena Williams had to deal with almost having a negative outcome. These are freaking billionaires, right? Wild. These are billionaires. And so we know that it's not necessarily money. We know that this is about unconscious bias for Black people. But how do you mitigate unconscious bias without doing, say, computer-based training and people are just clicking through it, where it's not necessarily changing anything?
Yes. I'm telling some me listen to this. It was on Facebook. I think some are gonna play it, because until the same time you hear certain things. When you hear certain things, it's like, all them people don't get it. How can them look upon it and say greatness belongs to only one person, one race? That's how Hitler did think. The mentality where some people have, man, it's so destructive. And some of them not change, Some of them not change. Them now not change a change. As we proceed, people.
I think the only thing that we can do really is to continue to talk. So you talk about it and making people aware that just because you see a Black person, you need to make a conscious decision, right? Because unconsciously, there are things that are playing in the back of your head. Consciously, you make the decision to say, I am going to look at this patient objectively and look at this pregnant person delivering this child, the objective data, use that to make a decision.
And based on what you said earlier, right, we're talking about the environment. Yeah. So we had that long list of stuff we had to check up. And when we speak about the mortality rate, usually all the blame is put on the hospital, right? But due to the environments that a lot of these women are in, it seems to make their mortality rate high anyway before they even get to the hospital.
I think it's a good question, and definitely logical, right? Like when you see a patient who doesn't have a bed to sleep on, who does not eat well, who cannot sleep because of the environment that she lives in. All of that is stress.
Stress and more stress.
All of that is stress. And so it's not the birthing person, right? It is the stress that that person is dealing with. And so what the clinician can try to do is help mitigate that in certain ways. And I think that's what states are doing with WIC. I think, helping people get the food that they need to get, infants the nutrition that they need. But policy has to change the rest. And that's hard. We would have to blow up the system.
Is the high blood pressure food, stress, genetics, or a mixture of food and stress?
I would say all of the above, all three: genetics, food, and stress. And so this is where cultural sensitivity comes in. When you say to someone, what are you eating? Are you seasoning your greens with ham hocks? Are you adding salt to your food? We like Black people, this might be a stereotype, like really seasoned food. Yeah. And so I've had to tell my patients, don't add any salt to your food. You could cook with the salt, right? Cook with it because you want your food to have flavor, but don't add salt to your food. There are some people who will literally add salt before they even taste it.
Yes. yes. Oh my goodness, that lady talk shoot people. People will salt the food before them. Hello, Mr. Sodium free sauces. Because we seriously eat too much salt. We do eat too much salt. I'm telling you, if I hang out with a Rasta man, a true Ital King for like a week, I want to see how nobody change. You see, once like the first day or two, when I mind, it's not to nobody, I don't mind, I go crave it, After you guys did, I feel like all a week. You guys gonna see the difference. Cause me tell you say once me start like cut down upon salt. Cause me never did like salt before. Somebody in our family did love salt. We say, oh, so from them time, then my body just despise salt. It just this my same time I did so frustrated with the sauces and the seasoning and just everything as salt. And we even talk, take it with a grain of salt. More salt. Even in our conversation, we have salt. People. That's why I say flavoring. You can't smell salt, but can't smell flavor. And flavor is delicious. I not cut off the doctor, but me just say, right? This is where I come in with my delicious and my healthy lifestyle. And that's what this is when we sell healthy lifestyle. Right? Continue, doctor.
Some people who will literally add salt before they even taste it. Yeah. Taste it and try to develop a palate that doesn't need salt.
Yes. The same thing I say when you got the Rasta man, the first 2 days it's gonna be, but me tell you same time me have it the first time, it's so flavorful, everything's in my mind, and I knew it was in my mind was telling me this needs salt. I knew it was in my mind. It was my body telling me some want more salt. In my mind, I tell me say, oh, this need more salt. Want to ruin the Rasta man them food. So all of them things that it's like once you know, people say them know, but they're not aware of the situation. Me know. That's all them ever say, and them not know nothing. Because once you know, it becomes an awareness. This is what I say, the words where we need to be aware of, stop using, like hate. Right? And it's not gonna be an overnight thing. It's never an overnight thing. It's always a work in progress. As we continue, doctor.
And try to develop a palate that doesn't need salt.
Now you're talking. Listen, people don't understand like how they have to recalibrate their palate. Mm-hmm. They think that, I know people can't drink water.
Yeah.
Like they need flavor, they need sugar.
Yeah.
That green thing is not working with them. That earthy taste is just not. That's just the reality, but we don't have that conversation enough. And the reason I bring it up is because they get so discouraged when they try to eat healthy. And they have to understand, like, fire, it's a process. You have to recalibrate that tongue.
Exactly.
Okay, and you're the one that talk about recalibrate. We can't even use the bigger. It's a mind, getting out of the mindset to the mind fluidity. That's my word, my mind fluidity. But to recalibrate your taste bud is the same thing to just doing the very same thing with your mind. It's cleaning out your mind, having a pure thought. This is how much I show you how you get there. With either you can use yoga, some people use weed, some people use reading, writing. So there's different ways to get there. To clear your mind. So you see them conversation. I love this conversation because you see, it's reasoning and understanding. I'm probably gonna cut out the hand out the 2 words, but we're gonna keep. We don't want to get too far away with them stop use word thing, Ayasa. Even though I blew here and my memory is pretty good, but again, it's the habit that we have that's not good. So I could just go and listen to the doctor.
To recalibrate that tongue.
Exactly. I would say probably 15 years ago, I cut out sugar in my diet, right? And it is a process. Thank you. It is a process. Should
people, I'm gonna say the woman look good. She a cough. I don't know if she have a cold, but she looks amazing. As we proceed,
it's more addictive to heroin. And so when I tell people that, they're like, what? I'm like, it literally changes your brain to make you think you need more. That is why people cannot go without a soda. That is why people like sweets, is because it literally changes your brain. So to your point, you have to recalibrate how you eat, what you eat. So no added sugar. And if any package of food that you're going to eat, so you have to learn how to read labels. Any package of food that you're going to eat, try not to eat processed. If it says it has 10 grams of sugar in it, more than 10 grams of sugar in it, put it back down. It's not good for you. If it has more than 10%, one item has more than 10 to 15% of sodium in it, one item, put it back down per serving. You don't need it. You don't need it. And so when we talk about genetics, food, what was the third one you said? Environment? Was it environment?
Genetics, food, environment, right? No. Stress.
Stress.
Yeah.
Most people who live in sort of within the city limits, corner stores. Everything I just said, they have all those highly processed foods.
Yeah. I said them just sit down. Yo, them just sit down like right at the corner, like just a wait upon you. It's by design. People, it's crazy, isn't it? As we proceed, people.
In there. That's all they have, because they don't have a Whole Foods that's next door. And even if they did have a Whole Foods that was next door, Whole Foods is expensive. Right. Eating healthy is expensive. And so it is that understanding that clinicians have to have, and you, as you have conversations with your friends and family, is an understanding of people's circumstances. They can't do everything at once. It's impossible. And that's where the stress comes in. And then they just say, forget it. I'm just going to go with what's easy, what tastes good, what feels good. It's important that we help people think differently about their food, going to farmers markets
not
versus
so guilty, not so guilty, you know. Not for real, because people like they try. I think people really, what I've learned, man. Like obviously, I talk to people for a living, right? Yeah. And what I've learned is that people really do want to get better.
Absolutely.
They don't know how.
Exactly.
And they get discouraged very quick.
Exactly.
You know, what was this?
All right, people. This man said, look, you say if we hang out on the channel, yeah, we're gonna do it together. You know what I'm saying? Because again, there's many people out there who is in a position where them feel to them it's them alone. But I tell you, it's not. You're not alone in that such situation there. See, because right now, I could look at my situation and feel I'm the only one in it, but I'm not. People out there in my situation, they might try to do them thing and it just seems like say, now I get the traction I'm supposed to get. And that's how I feel sometimes. Because I'm telling you, sometimes I invest my money. I invested my money to make more money. And sometimes I ask, okay, then how much money you're supposed to invest? People, look, I'm a person, I'm going to take things to heart. I try not to take things to heart because them say, Marcus Garvey take things to heart, and that's what ended Marcus Garvey. Even though I say that's not it. It was disappointment in people and how them want change, but them not want change. They want change, but they don't want to change. Just a conversation of people. This is not late night talk, but this is educational. You know what I say? As we proceed, people.
What was this sugar journey like? And why did it start initially?
So I grew up, I think my parents tried their best.
Nigerian parents.
Yes, they tried their best, right? My mom.
Big up all of the people them from Nigeria. One day I'm probably would like to reach Nigeria. But I'm meeting these people anyways, right? I'm meeting this amazing doctor, and I'm sharing. So I can go Google her and send a shout out on Instagram. Right, people? Because I'm telling you, say eventually, these videos, I say videos sit down there for all 3 years, and them have eventually about 3-4 million people view them. As we proceed, people.
Best
Nigerian parents.
Yeah, they tried their best, right? My mom and my parents grew up in Nigeria, and so they really didn't eat lots of sugar.
Yeah.
But they get to this country and they have kids who want to drink Kool-Aid and who want to snack and who want to do all of those things. And so I got to a point where I was drinking, and again, I was a nurse working the night shift and in the ICU, and I would literally every night have a liter of Mountain Dew every single night.
It's a rough one.
Every single night.
Exactly.
And I was like, yo.
I don't think she should have called the name, so people go. I'm just joking. But I'm just saying, it doesn't matter what pop it is. Drinking all of them pop there is not a good thing.
Mountain Dew tastes so good.
You're drinking a liter of Mountain Dew every night?
Yep. Every night. Yeah. And so at a point I realized, like, this is crazy. When you realize that sugar leads to inflammation, inflammation leads to cancer, it leads to all inflammation in the body, leads to all kinds of stuff. Like, you don't want that. And so I decided no more sugar.
What was that process like?
It was literally one of those things, like, it was affecting my health. And I said, all right, that's it. No more sugar. And so in order, though, to stop the addiction to soda, I literally went cold turkey. But I, too, am like those people you mentioned who like to have something flavored when they drink it. So to trick my brain, I drink seltzer water or club soda. Or
you drink Spindrift?
So Spindrift has sugar in it.
If
people don't, it does. Those natural flavors, like, it's no added sugar. Those natural flavors have sugar in it. It's too sweet. So bubbly, LaCroix, and Perrier.
So people, those are the things when I forgot drink and cut out the sugar and the bag of sweet. But really, but tell us that these programs, people, they're informative, they're educational, they're teaching. These are the things I love. If you cut out some of the program them and add some of them program to my watch list, right? So I can have knowledge of who we are. So I feel as proud as them is. Right? Right, people? We're up on the positive movements, We're up on the positive movements. And the ladies, them, like, they're intelligent people. They're I don't know them personally, but them is amazing. So people may tell you how much ladies me do in a row. I say, me start the ladies now, and it was like, so me now want to stop the ladies. Well, okay. When I really want to put when I really want to put too much in a one, because I tell you, say, like, I'm going to do a marathon of ladies. I don't know which day. I just go jump on and just do like 5-6 ladies where just that around 7 hours. Just attack consciousness and from freedom point of view. So, and I say I want to put ladies aside, but I want to do like there's a couple of things that came up I'm just eager for the highlight of them people here, because the thing about it is, these are the information that needs to be repeated over and over and over. So like how I see myself in the algorithm now, and I just have like my watch hours I go up, and I see the thing I go up fast. So this is why I say I want to create the content them, right? I can't do the thumbnail thing yet, but eventually I can put on the thumbnail on them. So I say I'm gonna do. I'm gonna sort out myself and start a live early, because I want to do some heroes later on, and them times there, I'm relax, and some of the noise died out. People, what I say, it's always manners, respect, It's always each one teach one how to be better, each one teach one to be unlimited. I go see if I can do my t-shirt shop, or I can put up my Be Unlimited something them. I'm tell you, say, I have enough thoughts and ideas, and then it make no sense me sit down here pan a gold mine when it's within us, right? And I can say, people, be your best you, and then me be the worst me, right? So I have my t-shirt, something them, everything set up. I go see if I can set up a shop for myself. So at least I can try set up a shop. Right, people? What I say? The best of us is always better than the worst of us. I always say that. Right? The best of us is always better than the worst of us. That's why there's us and them. You see the big difference? The us and them people. The us always do the best, the upright to yourself. The them always condemn. Okay, people? Thank the people. I'm telling some need. I'm asking for like 200 subscribers by the end of next month. So I guess me have to put in the work if we get more content, more books, people. Oh yeah, don't forget my trip. July I come. July we got Africa, and then my book library. I'm on all of these books with these great people. I want put together. Up. Manners, respect all the time. I jump on my channel one night and time I go on with some learning and some educational stuff, I'm telling you already, so it's gonna be a community. Or we can get together and be righteous. More people, more. Always more to come. When I watch it on the rewind and leave on a comment.